I would say personally, what a great start of the week, right? Just listening to all of the senior leaders from CDC, CDC Foundation, ONC, and all the change makers in the public health space. So for me personally, anyways, the takeaway has been being in this building and with all of you since yesterday morning is that there is definitely emphasis on in getting the right infrastructure and tools and technology in place to make all of the data modernization and things happen. But at the end of the day, that is means to an end. What is really important and our challenges are how do we get good data and how do we disseminate the information to the public while protecting the patient privacy and while making sure that there is no bias created as a result of that, right? Those are some of our biggest challenges. I just want to share that if you remember in the 80s with what happened with HIV and AIDS, when media ends up creating a stigma around a disease, the very people who need help, they end up not accessing health care and going to the doctors and don't get treated, right? So that's not how we want it to be. So how do we prevent this ascertainment bias? Similar kind of risk started coming up even with the monkeypox data a few months ago, not too long ago, and we all started experiencing some of that as well. So my colleague here, Gary Jackson, he will soon here talk about, we work very closely in partnership with University of Tennessee, and we created a system whereby not only we are protecting the patient privacy, but we created a demand-driven supply chain system so that we can get vaccines in the hands of the people who needed it the most. So with that, I just want to give a very quick 30-second plug for CGI in case some of you don't know CGI. We are a global large system integrator. We have presence in about 40 different countries, 400 different locations. And if you don't know CGI, the one thing that I want you to take away about CGI is that we are a team that is very, very mission-oriented and mission-driven, especially in the global public health space. So not only we do work with various US federal agencies, state and local territories, but even globally with the health agencies across Europe and UK and Canada. So that is a big mission space for us we work in. So that's my quick 30-second plug on CGI. With that, I want to introduce my colleague Gary Jackson here, who inspires me every day. He is a technologist at heart, and if you didn't know this about him, he is the first person who wrote the artificial intelligence generated magazine. But in addition to that, he's also a living example of why sharing health data is extremely important in the public health space, and I will let you share more about his story there. So with that, Gary, I'll turn it over to you. We are super excited to be here.
Great. Thank you, Ratima. Thank you so much. So, by the way, I'm very, very excited about this because I feel like I've been in kind of that patient zero experience multiple times. Back in 2009, 2010, I had H1N1 and infected 3 countries. I infected India when I didn't know I was sick. The customers I was working with, which was HDFC. I then went on to Shanghai, infected ICBC. The bank, and then went on to Manila in the Philippines, still not knowing that I was sick, and infected Globe and BPI banks. That experience and being locked down in a military quarantine between that, because I was living in Hong Kong, was an eye-opening experience. And that what makes me realize it's not about the technology, it's really about protecting the human. So everything I'm going to be presenting today is focusing on that. How do we protect the people in the community? And if we can protect one community, we can protect them all. So just as Ratima was kind of talking about, with CGI, we've been around since 1976, right when these chairs were installed. So you could tell. So it's about 48 years of positive growth. The other thing that I wanted to kind of bring out for CGI is we are focused in the health and life sciences. We have about 5,000 industry experts. I am very honored to be one of those experts, but I think that my expertise is being the focal point of a pandemic, not fixing the pandemic. So this is my place of heroes. So all the people that have worked here in the health services and CDC are the people that I look up to. So thank you for all the work you did, especially over the last 3 years. It's been phenomenal. You don't get a lot of credit, so I wanted to make sure you get that. Okay, so the first thing I wanted to talk about is the problem, and then kind of going through the solutions and that type of thing. And one of the things I wanted to make sure is that we get across is, yes, it is about getting the vaccine to the people, but there's so much that has kind of been wrapped up in getting that vaccine to people that we've kind of lost our way. When you look at these quotes, too, you can see that some of the quotes around, COVID and pandemics has all been loaded. The information has been loaded. Someone can look at it and see that as a bad quote. Someone could see this quote and see it as a good quote. But one key word out of this quote that I did want to point out is misinformed. How do we trust what we're working on? How do we trust the data that we're using? And how do I trust if I'm a patient, you're not going to weaponize it and try to come after me? That's scarier than death in some ways. That if you're living your life, but you're subjugated constantly because you happen to get sick. And so one of the things I wanted to make sure around this quote is not to say if it's good or bad, but how do we get rid of the misinformed? Not misinformation, but being misinformed. So the problem is, number one, get vaccines. There's nearly, and we're going to be focusing on MPOX or monkeypox for this one, because it's the one that's kind of hit the public psyche. It's been twisted in certain ways. Just based on our system, we've seen that there's about 30,000 who are infected just in the United States as of February the 23rd. So we do have vaccines for it. You do not have to die from MPOX, but you can lose parts of your life because of the stigma that's wrapped around monkeypox and MPOX. So what we wanted to be able to do is we wanted to be able to set up a solution that does four things. Yes, get vaccines on time to those in need where they live. That's so important, without revealing who they are. The other thing is patient privacy and protection, PII, GDPR compliance, HIPAA compliance. Some people just do it to be compliant. We feel that it is just as important to keep that healthy as the patients themselves. So we'll talk about how we did that. And prevent data as a weapon. So the very thing that we can use to get the vaccines to them, what we wanted to build is a solution that basically can keep that data in a secure place. I grew up in the 80s. I remember when HIV and the AIDS, the syndrome, was just kind of a stigma. I thought when I was a little boy that I would never be able to have sex again because of AIDS and HIV. I was 7. I didn't know what sex was. So anyway, that doesn't matter. But the concept was I was scared. And the same thing can be done when COVID came out, and then now with MPOX. So how do we prevent data as a weapon and prevent that? And then deconstruct misinformation. I want to be very clear about this. Someone's truth is their viewpoint. So I'm not here to tell someone what their truth is, but I want to make sure that the data is as real time as it was birthed. And you can't deny when it was birthed. And so when we say deconstruct misinformation, my goal is that this data was birthed. These are all the things, good, bad, or ugly, that happened to it, and we all can't deny that. So I'm not going to get into the whole political trust, viewpoint, that type of thing, but I do want to get into how can data be deconstructed to make sure that it is true data that we can use. So, solution. Normally, when you talk about something like this for a demand supply chain, especially around pandemic response and that type of thing, you normally just focus on the vaccines. And so let's go into the vaccines. And what I realized was there's several vaccines that help with MPOX or monkeypox. One of them is created by a Bavarian Nordic, and it's basically, I always say it incorrectly, but I'll just call it Bavarian Nordic because they create these. These are bird, kind of incubated. What's nice about those is they're a 2-dose series. They're given as a shot, but here's where we had to start looking at it. Not only are we given a 2-dose series, it only becomes being able to peak immunity after 14 days. So getting the shot itself isn't the solution. You have to keep them in a quarantine environment for 14 days for the immunity to hit. So that alone is an issue. Then we have a second vaccine, the ACAM 2000, and it's administered as a single dose. But what's great about this is it's really a scrape of the skin, and it creates 100 vial, think of it as 100 shots, but it takes 4 weeks after to create peak immunity. So 2 shots and 14 days of immunity, or 1 shot, 4 weeks, and how do you keep it contained? So that was the beginning of our process of figuring this out. Now, we couldn't do this alone. So that became a collaboration. We realized that the data was changing so much, we needed a digital exchange, a marketplace. I needed to be able to not, and what I also get a little upset about sometimes is everyone talks about digital exchanges or being able to create a data marketplace, and they only talk about that one word, data. There's so much more. I need the algorithms. I need the data, the training data sets. I need the visualizations. There should be a pure exchange of ideas on all fronts. If I don't have that, you just give me your data, I have to start all over again to figure out what you've already figured out. So I've wasted weeks. How can I share my IP, make it secure and protected, but allow it to be executed with my IP, and then maybe mashing it up together to create new IP? And that's something we started with University of Tennessee. So University of Tennessee, Knoxville, they have a supply chain management program. We partnered up with them to get this going, and we wanted to see, can we create a real-time supply chain that allows for collaboration, that we can protect privacy, and allow execution of IP that's being created. And because one of the other things is, we didn't want a new idea to be stolen. We get it. There's patents. There's money involved. You have to make money from some of this stuff. There has to be some kind of, zero-sum game. So how can we do that? And that's what we started working with in Knoxville. We also did a little partnership with George Mason University as well on the side. And what we ended up creating was, we created an immutable vaccine supply chain. We went towards a blockchain environment using Ethereum blockchain. Not going to get too nerdy here, but you know why? You know what I talked about earlier about the deconstruct misinformation? We needed a ledger that was transparent, that showed, as I'm trying to get a vaccine to you, all of the problems and logistics, and it's documented or stamped in the system so I can see those issues. And I can't go back and fix it or change it. I just see where how this is being derived and what it's being used. And so we made a decision, working with University of Tennessee, to create this immutable vaccine supply chain. So the blockchain piece allows us to be able to create these linkages, but then there was a second piece that we really liked about it, smart contracts. If a certain condition or something, certain terms or executing an agreement between two parties, it would automatically trigger certain actions. So allow this to programmatically say, hey, we've got a problem here. Or, hey, if this happens, then reroute to this. So that was something that we were really, really excited about. But then we ran into some other issues that we had to. So we have an immutable ledger. And I know a lot of people think of blockchain as a cryptocurrency. It really isn't. It's the accounting ledger. It's debits and credits. But I want to say, everything is documented. And if you try to erase it from one ledger, I'm so sorry, 1,000 other ledgers have a copy of it. So you can't try to lie to it as you're going through the system. So we built what we call it a DeSci marketplace, a decentralized science marketplace. And we started partnering up with the University of Tennessee, George Mason University. We started building some aspects of it, and we created APIs so we could actually offer it for federal agencies. What was happening is we actually created assets that could be exchanged. Data, algorithms, visualizations, and metaverse objects as well. So we're going to show some of those as well. What we wanted to be able to do is, if I have a data set, and I'm the university, and you have an algorithm, I can combine those two together and mash it in the marketplace and get a query out of it, but it only gives me the answer that I'm looking for. Very, very, very focused answer to protect PII. The reason we did this was we just didn't want the process of, here's my algorithm, let me figure out how it works. Okay, here's my data set, now let me download it, let me try to go through it. If it's important to you and you're using it, it's important to us. And I'll show you some examples as we go through this. But what we're really trying to advocate, and whether you're with CGI, federal, or whoever, we really want to promote creating this collaborative environment, this data science or DeSci marketplace. So one of our first assets we started to build was these two. The first one was inventory days of supply. We wanted to make sure that we had enough inventory from these the manufacturers to be able to get it to the people that are sick. So that was our first algorithm that we started creating. The second algorithm we created was perfect order percentage. So we wanted to make sure that we could identify the percentage of orders that get shipped that aren't damaged. And by itself is great. Those two algorithms are fantastic. But then we also needed to be shared between different organizations and different groups. We need to be able to share static data sets, training data sets, and most importantly, time-boxed real-time data. And I say that, when I say real-time data, it's important, but as you know with a pandemic, as soon as the data is written out, it's kind of obsolete, especially when you have contact tracing and things happening. So those are assets, these are assets separately, and then we also built metaverse objects. We knew that nobody would believe our stories. We had to be able to create visualizations that I could project or show into a room. We can walk around the data. I mean, you can see with this QR code, if you use your phone, you could be able to use our visualizations that we're building out, project it into this room, and be able to have a discussion. Remember, the technology is important, but saving the humans is the most important. And you can't save a human without having a discussion, an honest discussion with it. So we created objects that were just not algorithms and data sets. We also created these immersive objects for visualization purposes so people in different places could come together and discuss the data in real time. So the action around this. So we built something we called a trusted execution environment. Not going to get too nerdy here. I can definitely talk about some of the details later, but think of it as a cocktail shaker. We wanted to make sure that if you have a data set and I have an algorithm, and we know that those two are matched together, I could actually do a query that only gives me the result that I need. And what do I mean by that? With a cocktail shaker, you only put in enough information or data in there for one drink for yourself or a friend. We wanted to make sure that we don't have data movement. Once data moves, it can be misinformed. It can become obsolete. We just need real-time data or just-in-time data. That's a better way of saying it. So we built this trusted execution environment so different universities, different agencies can run queries against each other and get the results out, but you only get the pieces that you wanted from I call it our cocktail shaker kind of module as we do this. But the other one, 5 minutes. So the other one that we have is our introduction of zero knowledge proofs. Zero knowledge proofs is a way that we can use a magic 8-ball around patients. I don't want to know your social security number. I don't want to know the actual address or your last known address. I want to know, how do I get the vaccine to you? Are you in this area? Yes or no. Binary answers. So we use what we call this zero knowledge proof so we don't have data PII spillage, because privacy was so important to us. So it allows us to be able to query information, get yes or no answers, or maybes, like the magic 8-ball, but we can actually be able to respond to the people that are sick. So that was something that we also built with this solution. And as you talk about PII, one of the things that we had, the gray area between sensitive and non-sensitive. We say non-sensitive is gender, is it non-sensitive? And does that associate to sexual orientation? So one of the things we had to be careful was protecting those at all costs. We cannot allow the data to be weaponized. We can't allow people that are getting sick to be persecuted because of their being sick or their lifestyle. So the impact. So our number one goal was ascertainment bias. What we were doing as we were building this out and getting the solutions out of this, we did feel that the relationships that LGBTQ community has with their doctors was stronger than the heterosexual one. Relationships with the doctors. So it did create a somewhat ascertainment bias. So as the data as we're going through trying to find this vaccine information and get it to people, we were concerned that the ascertainment bias would kind of spin things out of control or pivot. So we are working on that part, but we were trying to make sure that we realized there's more of an infrastructure or technology thing. There's a human focus that we were missing. And that's vaccine equity. So our goal here is that we need to get the vaccines to where they are. Location, 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 just like sales, right? And also finding those people that mistrust the government, those type of things. How can you still get it to them even though they don't trust you for giving it to them? And that's where we came up with some other analytics that we thought were kind of insightful. Not only do we want to create a blockchain ledger, We wanted to also create contact tracing around trust. So one of the solutions that we built out is, can we create an organic, immutable chain of trust? I can't stress this enough. Your intimate relationship with your doctor is probably the most valuable tool that all of you have to stop pandemics. But we're doing contact tracing, but no one is tracing that relationship. We need to be able to say, who speaks a conversation and I listen? That can save lives. So as we're looking at digital information, we need to be able to find who is the person of the same age, race, sex, language, background that can speak to them and get them to trust us that we are trying to help them. All of the data in the world and all the vaccines in the world, if we do not figure out a way to create this organic, immutable chain of trust, no one is going to try to save themselves. And that was something that we found out as we started digging into this, and we started building out visualizations around that, still protecting PII and still getting vaccines to the people that were in need. So I went through this pretty quick. There's so much to talk about in a very small amount of time, but I did want to leave it open for questions. But I did want to say one last thing that I started with, but I do want to kind of wrap up with is, if we save one community, we can save them all. And being a person that had H1N1, infected 3 countries, and I will say this, I actually was so proud of myself, didn't get COVID until 2 weeks ago. Finally got COVID. I was like, dang it. And I'm coming to the CDC. I knew I was going to come speak. I'm like, damn it. I can come to the CDC, and then I got it 2 weeks ago. So one of the things is, remember all of the things you're building. Remember your grandmother. Remember your wife. Remember your husbands. It's humans that we're trying to save, not build the technology just to make it happen. Any questions?
Any questions? Anybody?
Hi, Gary. Thank you so much. I do have a question on the last slide you had around the organic, immutable chain of trust, and that certainly being very important. But prior to that, you talked about how you collect the data, kind of provides that perhaps insights into who it's about. So can you say a little bit more about when, how do you build, how do you get that data when, if you're already starting from a place of distrust, to be able to get them to that point of being able to share that?
I have a concept I call affinity of analytics, which basically, for example, if you and I had a conversation and I found out that, I grew up in a very small town called Auburn, Alabama, and we both came from Auburn, Alabama. It's strange. I don't know you, you don't know me. But you're like, oh, you're from Auburn? I'm from Auburn. Do you know so-and-so? Yeah, I went to their store. You immediately have trust. But I didn't record anything about your sexual orientation. So I know that I can have a conversation with you. You know where I come from. Remember, the thing that's killing us around deconstruction misinformation is it's coming anonymously. And they just believe it blindly. Once you build that you have the same base, and you're coming from the same home, the same place, you get me. I don't care whether our color or our race or our gender. You get me, because we come from that same place, and you might trust what I'm saying. So one of the things that we built was kind of a context engine. As we're building this, we find little context clues so we can say, hey, bring up. And you know where I got this idea, by the way? Total stole this idea. I do stand-up comedy on the side, and find in those little bitty sayings that bring people together. Who's married in the house? Those little contexts can create trust. And I know it sounds silly, but remember, when you're saving all this data stuff, the minute details don't bring them close. It's that context and knowing that they can trust you because you come from the same baseline. That's where you can start building this immutable chain of trust, if that makes sense. Yes. Any other questions?
I had a question on that QR code.
Yeah. Yeah, I can bring it back.
Like, I was interested in how you created that.
Yeah, so I would love to say I am a genius, and I built it myself. But so one of the things that we realized is, as CGI, we are not going to be able to create everything for everybody. So we're partnering with everybody. One of our frenemies. So one of our technology partners is a company called Flow Immersive. They're a brand new technology, brand new startup. I've worked with them even when I was overseas, and they create interactive, immersive visualizations. And what's beautiful about this, you'll see this is COVID over the years, up to real-time data, But not only do you see it, I can take my phone, project it into a room, and as all of you are looking at it, I see where you're standing in the room looking around it so we can have a discussion. Or if we're in different places, I can actually project it into a room and I can see what you're looking at as opposed to me so we can have a discussion. Having a storytelling session around data is the key. Throwing a statistic out there, you have to, remember back in the days when stats won everything? You have to prove it now. And how do you prove it? You tell stories. And you come from that base of context and that baseline. So that's the most important part. Anyway.
Thank you.
Thank you so much. I appreciate it.